Even with advances in medical technology and living standards, the United States still ranks near the bottom of the world's wealthiest nations in infant mortality, which is children dying before their first birthday. John Yang reports on efforts to address the problem in Cincinnati, which has one of the highest rates in the nation.
You ready to put your shoes on?
In Cincinnati's Avondale neighborhood, it's a typical morning for Ashanti Davis.
What's this color?
Getting 4-year-old Royal ready for daycare, while also tending to King Adam, who was born in October. Arriving to lend a hand and offer advice,
Hi, Miss Brown.
fellow Avondale resident Tina Brown.
Just lay you down on your back.
So you've been keeping the baby in the crib? You ain't been sleeping with the baby, have you?
Nah, 'cause I don't want to roll over on them.
That's right. So you
Gotta
got
keep
it
him
down
safe.
pat, Mommy. This came across my desk.
And she has a tip on a hospital job for Davis, who currently works for the Cincinnati Parks Department.
Hospital worker readiness program.
During both pregnancies, Davis had gestational diabetes.
Hi, sweet Miss Conti.
But with King Adam, she had Brown at her side, counseling her on diet, going with her to doctor's appointments, reminding her to take her medications.
Good job with your diabetes, though. You're doing great.
Thank you. With this pregnancy, it was easier me knowing that I had somebody to help me out and stuff like that. And every week she came with some type of resource.
Tina Brown is part of a broad effort shaped by mothers and focused on mothers to reduce the rate of infant mortality across Cincinnati. As recently as 2011, this county had the second highest rate in the nation. And despite a 15% drop over the last 5 years, it still ranks in the top 10%.
We're ready to go.
Okay.
The arrival of King Adam didn't signal the departure of Brown from Davis's life.
That's cute.
On this day, Brown went with her to get clothes for both children at a pantry run by Carmel Presbyterian Church.
You should get these for her.
I didn't see them.
I call her every day, see how she doing. You know, just kind of see what kind of mood she in. We got a close bond. Me and Ashanti got a real close bond.
A year ago, the women were total strangers. Brown was matched with Davis as her advisor and advocate, what's called a health champion, by the Community Builders,
Got it?
the nonprofit development company that owns the building where Davis lives.
King's going to the doctor regularly.
Brown is one of 9 health champions the company employs. Altogether, they currently counsel 64 families with either a pregnant mother or a child 6 or younger.
Through housing, we have a unique access point to reach our residents.
The developer is considering expanding the program to its affordable housing properties nationwide. Jody Cunningham is the Avondale project manager.
It's really great having actual neighbors leading this. It's a different connection that they can have with moms. It's easier to build trust with our residents. It's easier to know what will work. And they really are the experts on Avondale.
The predominantly African-American neighborhood has historically had one of the city's highest rates of infant mortality. It's also home to Cincinnati Children's Hospital Medical Center, which houses Cradle Cincinnati, a campaign to reduce infant mortality countywide.
The most important part of our work has nothing at all to do with the doctor's office.
Cradle Cincinnati Executive Director Ryan Adcock says listening to women is essential.
These moms live and breathe in their neighborhoods, and therefore they're experts when it comes to the place that is influencing their health. And so it's almost daily when I talk with moms that they teach me something that's going to be instrumental for the change that we're trying to make.
You see, Mom?
And it's not just physical conditions that influence their health. In Cincinnati and nationwide, high infant mortality is driven by the fact that black infants are more than twice as likely to die as white babies, regardless of the mother's income and education.
An African-American mother with a master's degree is more likely to lose her child than a white mom who never graduated from high school. It forces us to ask questions like, what is different about the black experience in America that is leading to these poor outcomes? And we do think it has to do with bias. We do think it has to do with racism. We think these things lead to very real stress that does impact pregnancies and impacts the outcome.
Racism in day-to-day life, including black women, say, at doctors' offices.
Tell a story about when you realize how much race matters.
At a recent gathering of Cradle Cincinnati's Moms Advisory Board, women prepared to share their experiences face-to-face with medical professionals. Lavinia Jones is a new mom.
You'll hear doctors and nurses like, oh, they're just exaggerating, you know, and not really listening to them because it's a black person. But if it's like a white person, it's just like, oh my God, like this is serious. These preconceived notions, like if I give her this medication, they'll sell it. You don't do that to our white counterparts.
Black women want to come and share.
Meredith Shockley-Smith, Cradle Cincinnati's Director of Inclusion and Community Strategies, says physicians and nurses welcome the feedback.
Surprised is very often a response. Why are you afraid of me? Why do you feel like this is not a safe space? I think there's just a need for education and training, and they are asking for that.
Advisory board member Jara Boyd, a singer-songwriter, lost a baby in 2013 after only 4 months of pregnancy.
It was a very traumatic experience. I felt lost. I felt discouraged. And
Had there been warning signs before?
there were no warning signs, but I was under a great level of stress, which I feel like added to what ended up happening.
But it's not
She says the stress came from an unhealthy relationship, which she did not feel comfortable discussing with her obstetrician, who was white.
I don't really feel like the environment was serene and comfortable for me to open up and express myself. I really felt like I was just another patient at that time. And that's not a good feeling when your life is at stake. Yes, Symphony. That's my name tag.
In September 2017, Boyd gave birth to her daughter, Symphony. She had sought out a different doctor who is black.
It was a totally different relationship from the one I experienced in the past. Ultimately, she came out a happy and healthy baby, and she's just full of life and excitement.
Boyd and the other moms on Cradle Cincinnati's advisory board share their experiences in the belief that interactions outside of doctors' offices will help produce more outcomes as happy and healthy as these.
Not a big boy.
For the PBS NewsHour, I'm John Yang in Cincinnati.